Make it. Okay, good morning, Cass. Okay, Maimuna Kasim has joined. All right, you're welcome. Okay, we need at least 60% of the class to join before we begin. I'm only seeing 3 people so far. Okay. Please, if you have joined, write your name for attendance so that I will know you have joined. Okay, Mariam Mukhtar Abdullah is here. If you have joined, type your name. I'll know who has joined. If you have joined, write your name. Okay, we have Sarajo has also joined. Sarajo Abdullah, you're welcome. Okay, Faiza is here. Sharifa is here. Lucy is here. All right. We need at least 60% of the class to join. That I'll begin. Muhammad Kolo is here. Maimunat Salihu, okay, you're welcome. Okay, Hassana is here. Omar Gombe is here. We need 60% of the class to join for us to start. So I need to see at least 35, 36. But anybody that does not attend the lecture should not blame me, but blame himself if certain decisions are taken. Okay. Laraba Matamba is here. We still need more people to join for us to start. So before other people join, we have discussed, Rebecca is here, we have discussed diabetes in detail. What is left in diabetes is the drug treatment of diabetes. So we'll continue with that, but I need numbers. We only have, okay, we have 18 so far, which is not good enough yet. Because I don't want anybody to be dragging me back once the lecture has begun. Once the lecture has begun, nobody should drag me back. So I need numbers. What Halima Hero is here. So we only have 16 here. Marcus Yakubu is here. So by the time is I'm giving additional 4 minutes. Anybody that does not join will be regarded to be absent. I'm giving additional 4 minutes. Anybody that doesn't join will be regarded as absent. So, but let's take a recap of the diet management of diabetes. We say that the diet management of diabetes depends on the glycemic index of that food. And I explained that glycemic index of food is a ranking system that measures how fast and to what extent a food item increases the blood glucose level. So we gave an example that there are food that have high glycemic index, those that have moderate or intermediate glycemic index, and those that have low glycemic index. And we explained that um, generally refined sugars such as monosaccharides and some simple sugars such as certain disaccharides like table sugar and honey have high glycemic index. Carbohydrates in general have high glycemic index. Protein, not all, but most have moderate glycemic index, and vegetables have low glycemic index. So today we are going to discuss. So I am taking attendance now. Anybody that needs to join should join now. Okay. So today we are going to be discussing um, the drug treatment of diabetes. So drug treatment, it is important to categorize the treatment of diabetes into type 1 and type 2. Because if you do not categorize the classification, you will not be able to determine what is the best drug treatment for that individual. So if you look at it, people that have type 1, as I earlier explained in the previous lecture, that they do not have insulin at all. So you will agree with me that the best treatment for those with type 1 diabetes is of course insulin. So people with type 1 diabetes, they need insulin for um, control of their blood glucose and for survival. So if you so please do not write any other person's name apart from your name. I will not recognize it. If anybody has challenge that he cannot join, you should tell the class rep. It's the class rep that will explain to me why that person is not joining. Right. So if you have any challenge, let the class rep know. Then later after this lecture, the class rep will. But I know that during the last lecture, almost 50 something people joined. That means I expect that 50 something people should be able to join. But you can see what we are having here is 19. So I will not regard any other name apart from the name of the person I'm seeing on the live uh, streaming. Okay, so let's continue. So people with type 1 diabetes require insulin to control their blood sugar. So without insulin, they cannot control the blood sugar. Why? Because they don't have any insulin. So any drug you're giving a person with diabetes is to improve insulin secretion and function. But if an individual lacks insulin, does not have any insulin, that means if you give any drug to improve insulin secretion and function, you are just wasting that drug. So people with type 1 diabetes require insulin. And there are different types of insulin. There are insulin that act within a short period of time, we call it short acting. There are insulin that act up to 12 hours, we call it intermediate acting. And there are insulin that act up to 24 hours, we call them long acting insulin, right? So for the short acting insulin, we have the humulin. R, and atropine, the human insulin. This is the type of insulin that's readily available all over, and is the type of insulin that you have seen for those of you that have gone to emergency, that you see in the emergency and the ward. They are the insulin that you use if you want to rapidly reduce the blood glucose, the short acting. So while the intermediate acting, which lasts up to 12 hours, you give a patient that is not necessarily in the hospital, and it lasts up to the duration of action up to 12 hours. So you need to administer it at least twice a day to cover up for the 24 hours. Example of that is the Humulin N or isophane, right? So then the long acting is the one that adds up to 24 hours. You have the insulin glargine and insulin detemir. Remember that I have already shared the slides with you. So you go to drug therapy, you will see the insulin and other things that I've stated there. Right? But as I said, if you do not attend lecture, it may be difficult for you to understand the slides in the lecture. Okay, so what is the problem with insulin? One of the major problems with insulin is weight gain because it's an anabolic hormone. It increases the synthesis of protein and fat, so it makes you to gain weight. So one of the major side effects of insulin is weight gain, makes you to add weight. Secondly, another major side effect of insulin is hypoglycemia, low blood glucose, especially if you're using insulin. You use insulin without eating, or you use insulin and eat very little. So another side effect of insulin is hypoglycemia. So if you're following me so far on insulin, which is the best treatment for type 1 diabetes, write just write high. Comment high or we understand. But if you have questions so far, write the question. You can write high or we understand or I understand. Anyway, you should speak for yourself. So you can write I understand, or if you have question, then you ask. Before we go, good. I'm seeing hi. Okay, Mariam Saleh. Okay, all right. Nuruddin also understands. Okay. If anybody has questions, should ask, please. Okay, so you're all following me. Very good. Okay, understand. All right. So the next thing we have discussed how to treat type 1. The next common thing is how to treat type 2. If you remember vividly, we said in type 2, they have small amount of insulin. But the problem with that insulin is that it's not functioning properly. Since the insulin is not functioning properly, what you need is a drug that would either increase the secretion of insulin or a drug that will improve the function of insulin. Okay, so you need the drug that will either improve the secretion of insulin in type 2 diabetes, or a drug that will improve the function of that insulin. So let me give you examples of some of the drugs. I will say I didn't understand explanation of the one. We are not discussing type 1. We are discussing insulin, not type 1. We say type 1 don't have insulin, so the best treatment is insulin. So we are not discussing type 1 now. Okay, so for type 2 diabetes patient, you treat them one, even type 1. We have already discussed lifestyle and exercise, where it doesn't matter the type of diabetes the individual have, you must engage in lifestyle and exercise. So in type 2, you give the drugs that improve insulin secretion and insulin function. So drugs that improve insulin secretions, we call it secretagogues. Somebody like insulinogenic. We call them secretagogue, from secretion, secretagogues, right? So this drug improves secretion of insulin from the beta cells of the pancreas. Example are sulfonylurea. If you go to your node, you will see sulfonylurea. So when you go to reverse, you see. And sulfonylurea include your glibenclamide, which is the downhill that you know. There's glimepiride and the rest. So what they do is that they increase secretion of insulin. So if there is increased secretion of insulin, they still have two side effects, which is weight gain and the risk of hypoglycemia, right? Then another type of drug, which is the pillar of treating type 2 diabetes, is metformin. Metformin, what it does is that it reduces the production of glucose from your liver. You know, liver has glycogen and also undergo gluconeogenesis. So it reduces the production of glucose from the liver and also improves the function of insulin. So at the point of action of insulin, metformin improves the function. So I told you that the drugs that we use in treating type 2 diabetes either improves the secretion or improves the function of insulin. So metformin, which is the popular glucophage, improves the function of metformin. So these are the major types medications in type 2 diabetes. The other types, if you want to know, you can read them, but I will not ask you. But I will definitely ask you about metformin and the sulfonylurea, such as the glibenclamide, which you know as the downhill, and also the glimepiride. But know this very well. If there is risk for hypoglycemia, especially in the elderly, it is advisable to avoid sulfonylurea in the elderly because being an elderly person, you are already at risk of hypoglycemia. So we should try and avoid sulfonylurea in the elderly individuals or those who have risks for hypoglycemia. Okay. So if we have followed the treatment of type 1 and type 2, please document that I understand. Type I understand, I understand, I understand. If you have question, any question whatsoever on the treatment of type 1 and type 2, please type it. Let me see. If you have any question, type it. If you understand, right, I understand. Okay. So I'm saying I understand, I understand, I understand. Okay. Any other? So any question? I'm moving away from treatment of type 1 and type 2. If you have any question, write it because I'm going to give you questions to answer. Okay, Abila said we should avoid sulfonylureas in the elderly. Which one should we use? So in this elderly, you can use the glucophage metformin. Then you can use other drugs like pioglitazone. Pioglitazone. That's why I say I don't want you to ask you discuss too many things on the drug, right? But you can use pioglitazone. Pioglitazone, what it does is that it improves the function of insulin. So you can use pioglitazone. There are other drugs like Galvus, but these ones are expensive. So you can use metformin with pioglitazone. if you have an elderly person and you're afraid of the risk of hypoglycemia. Okay, okay, Kolo is asking me, needs more explanation on type 2 drugs. You have to say what explanation you need now. Which area? I said there are two drugs I want you people to know, metformin and sulfonylurea. The other ones are there, but as I said, don't bother yourself. If it's beyond metformin, sulfonylurea, and sometimes pioglitazone, send the patient to a specialist like me. Hmm? So, but basically, use metformin and sulfonylurea. Some of you just came in, so if you're asking for explanation, I will not give you. I've already passed that. Okay, at least Nuruddin was around when I explained insulin. So insulin, I said, major side effect is weight gain. You add weight, and there is risk for hypoglycemia, especially if you use the insulin without eating, or you are at risk of having hypoglycemia, or you mistakenly give yourself large dose of insulin. Some of you are just coming. You cannot just come and ask for explanation. If you are just coming, you have to watch the live video later. But I cannot, as I earlier said, I cannot be doing the lecture and be going back. Uh, okay, very good. Abila asks, what's the formula you use to calculate the actual dose for the insulin? Very good question. So the actual dose for insulin, if you are giving somebody insulin, if it is type 1 diabetes, you use 0.3. If it's type 1 diabetes, you use 0.5 international unit per kg to 1 international unit per kg, depending on how the blood glucose is. So, like, let's say the weight of the type 1 diabetes patient is 18, right? If it is 18, 0.5 times 18, right? But 18 is too small. That's more of a baby. Let's say the weight is 60. 0.5 times 60, that's 30. So that individual requires 30. So it depends on the type of insulin. If you are using Mistat, which is, you people are not doctors, so there's limit to which things that I can tell you. But if you are using Mistat, and Mistat is a combination of a short acting and intermediate acting. So if you're using Mistat and what the individual requires is 30, right? So you give two-thirds of the 30 in the morning, one-third of the 30 in the evening. So you give 20 in the morning, 10 in the evening. Are you getting me, Abila? So this is how you do it, right? The common insulin we use in this environment is Mistat or premise insulin. So for type 1 diabetes, you use 0.5 international unit per kg to 1 international unit per kg. So if you're going to use that, if someone is 60 kg, 0.5 times 60, that's 30. So you have the total of 30. And out of that 30, you give two-thirds in the morning, that's 20 in the morning, one-third in the evening, that's 10 in the evening. So that's how you give insulin, right, for type 1 diabetes patient. So the reason why I prefer using 0.5, if you use 1 international unit per kg, you may give the patient too much dose. You start with the lower one and be increasing gradually until the sugar normalizes, right? So Abila, if I answer your question, respond so that I can move forward. All right. Yeah, you can use metformin for adults and elderly. Metformin has no risk of hypoglycemia. The only side effect of metformin is diarrhea. So some people may have diarrhea, and after some time, the diarrhea will stop. So metformin can be used both in older adults and elderly. There is no risk for diarrhea. Abila, you're not You're not paying attention. Atrapid, I gave you example of different types of insulin. I said there is short acting. The short acting is the human insulin. The human insulin has different companies type. This lecture, I don't discuss company. So, but example of it, I gave Humulin R. But other company of short acting insulin, which is regular insulin, is Atrapid. And you use regular or short acting insulin during emergencies. You use it during emergencies to lower the blood glucose because it's short acting and the onset of action is fast. So you want to rapidly reduce the blood sugar. So Atrapid, Humulin R, they are all examples of short-acting insulin, which are regular human insulin. Then there is Humulin N or Isofane, is example of intermediate acting insulin. Then there is insulin glargine, Lantus, if some of you have come across it, right? Is the long-acting insulin. But for people at home, type 1 diabetes patient at home that are giving themselves insulin, we use the Mistad. But for the patients that come in with emergency, either HHS or DKA, we use the Atrapid that you mentioned and the Humulin R. So very good one, Abila. You are very engaging. I need more questions like that. If you have more questions, go. So like Abila has hospital somewhere. His questions are practical questions. Okay. All right. So more questions or I move forward. Or if there are no questions, please write proceed. We are going to discuss prevention of diabetes next. If no questions, write proceed, proceed, proceed. So today almost half of the class is not here. Yeah, so today almost half of the class is not here. Okay. As I said, I will definitely have mark for attendance, and don't expect any mark for attendance if your name is not in the attendance. So the 0.5 to 1 international in per kg is the daily requirement, right? But if you're using Atrapid, that one is emergency, and that one in emergency you are supposed to use 6 international unit hourly. What I'm talking about 0.5 international unit to 1 international unit per kg per day is daily requirement. It's not in a period of emergency, right? It's not in the period of emergency. It is the daily requirement of insulin, and it's usually for Mixstat. Okay, let's discuss prevention. So for the prevention of diabetes, as I talked to you before, prevention includes primary prevention, secondary and tertiary prevention. So for the primary prevention, you want to ensure that you deal with the risk factors so that the individual does not develop diabetes. So what are the risk factors for diabetes? So for individual that is obese, you counsel them on exercise, dietary changes so as to lose weight, right? For individuals that have family history of diabetes, you teach them on how to live healthy to ensure that they do not develop that they do not develop diabetes. So those who have family history. For those who have hypertension, you try and control the blood pressure so that the blood pressure will be normal. For those who smoke, you counsel them on how to stop smoking, right? For those who have problem with cholesterol, you teach them or you give how to live healthy, to lower their cholesterol, and if need be, you give them medication, right? For those who are sedentary, they don't engage exercise, you prescribe exercise that will help them lose some weight and control blood sugar. So that's primary prevention. For secondary prevention, this is for individuals that have already developed the diabetes, but you want to reduce the risk of complication. And the only way to reduce the risk of complication is by one, controlling the blood glucose. The blood glucose should be normal and tight. If you remember, I say for fasting blood glucose, we want it to be between 4 to 6. For random, between 4 to 10. It shouldn't be more than 10. All right. So and the HbA1c should be 5.6 and below, or less than 5.7%, if you remember our previous lectures. So you need the blood glucose to be normal. You need the BP to be normal. Ideally, the blood pressure should be 140 over 90 or below. It shouldn't be more than 140 over 90. It should tighten the cholesterol. The HDL cholesterol shouldn't be low. The good cholesterol should be normal, right? The bad cholesterol, LDL cholesterol, should be also normal, right? Triglycerides should be normal. Total cholesterol should be normal, right? So all these things, then you screen for complications. You remember we discussed the complications of diabetes. So how do you screen for it? For eye disease, a diabetes patient should go to the ophthalmologist and check the eye at least once a year. All right. So that's for eye. For neuropathy problem with the leg, the diabetes patient should check the leg at least once a year. So the diabetes specialist, like endocrinologist, should check the leg at least once a year, right? Then for nephropathy, you ask the patient to do urinalysis. The earliest damage to the kidney is leaking proteinuria, protein in urine. So you check urinalysis to see if there is protein in urine. So you're checking very well. Then for the macrovascular complications, right, for the leg, you can do Doppler for the leg to see if the blood vessels are narrow. So you screen for all these complications so that the complications will not happen while you and the patient are not prepared. So that's the importance of screening for complications, so that complications will not happen. So the secondary prevention is trying to ensure that complications do not develop. Then the tertiary uh, uh, prevention is that you want to limit the progression of any complication. So if somebody has subtle eye problem, you treat it so that it will not progress. If somebody has some neuropathy, you treat it so that it will not lead to amputation. If somebody has proteinuria, you make sure you take care of it so that it will not lead to kidney failure. So any subtle complications that is here, yeah, that is there, you ensure that is taken care of so that it will not progress and the individual's quality of life will improve. So what are we saying? There is primary prevention, right? So as to prevent the disease. There is secondary prevention, so as to control the blood glucose so that there won't be complication. Then there's tertiary prevention to treat early complications so that it won't progress. So any question on prevention? If you have, please type it down. Any um, question on prevention? So primary prevention, we are targeting those at risk of diabetes. like people that are obese, people that have family history of diabetes, people that have hypertension, cholesterol, smoking, not exercising, eating unhealthy. That's primary prevention. So any question on prevention? If there are none, you document proceed, you write proceed. Any question on prevention? If there are none, please write proceed. So that will answer some questions. Any question on prevention? Okay, Hasana said proceed. I need at least 4 proceed. Okay, Sharifa said proceed. Okay, proceed. Okay, Nuruddin says secondary prevention. I say secondary prevention. The individual has already developed the disease. Your target is that that individual should have no complication. So, and there, what are the ways that you prevent complication? One, you have to screen for complications so that the complication will not just meet you unaware. So, how do you screen? What are the complications? Eye problem. So, you check your eye every year. Leg problems, neuropathy, you check the leg every year. Kidney problem, you do analysis to check protein, which is the earliest sign of kidney damage, right? Then what else? You, if there are problem with the leg, you check the blood vessels in the leg. You can also check the heart so that there won't be any sign of heart attack, right? So all these ones you're screening for complication. But apart from screening for complication, what prevents complication is the blood glucose should be good, the BP should be good, the cholesterol should be good, isn't it? The individual should not smoke, isn't it? And also engage in exercise. So all these ones are trying to ensure that that individual does not develop complication at all. Okay? All right. So let's ask her some questions. If you're ready, right? Ready. I need 4 readies. Then we'll conclude diabetes. After answering this question, we have concluded diabetes. We are not going back on diabetes. Our next lecture will be obesity. So make sure you do not have question. So if you are ready for the questions, right, proceed. Or sorry, you say write ready. Good. Khadija wrote ready. You can write ready. Okay, very good. So question number 1. What is the treatment of choice for individuals with type 1 diabetes? What is the treatment of choice for individuals with type 1 diabetes? A. Metformin. B. Downhill. So A. Metformin. B. Downhill. C. Insulin. D. None of the above. So A. Metformin. B. Downhill. C. Insulin. D. None of the above. Okay, so yeah, Saudato has already answered. The answer is insulin. So the best insulin. The best treatment for uh, insulin. Yes. So it's insulin. No, the best treatment for type 1 diabetes is insulin. So, okay. All right. Okay, so number 2. Number 2 is the following drug improve insulin action. The following drug improves insulin action. As I earlier said, I talked to you about drugs that improve insulin action and drugs that improve insulin uh, secretion. So the following drug improve insulin action: A. Metformin, B. Downhill, C. Insulin, D. None of the above. So the following drug improve insulin action: A. Metformin, B. Downhill, C. Insulin, D. None of the above. Which of the following drug improves insulin action? A. Metformin, B. Downhill, C. Insulin, D. None of the above. Okay, Marcus Yakubu wrote metformin. You're right. So metformin. Lucy also wrote metformin. Right. Metformin. Yeah. So metformin improves insulin action. You cannot say insulin improve insulin action. That's repetition, isn't it? So it's metformin that improves insulin uh, action. Okay. So I am conclude so with this I am concluding everything pertaining diabetes. I am concluding everything that pertains diabetes. So if you're all satisfied, the answer is made from here. If you're all satisfied with diabetes, please write proceed. Let's go to the next topic. I need four proceed, please. And we'll go to the next topic. Okay, so I have four proceed. So we'll proceed by discussing obesity. Obesity is a very important non-communicable disease. Obesity, like in the United States of America, more than 40% of their population are obese. This is due to the change in lifestyle because we are in the age of computer and the age of um, junks. So a lot of population around the world are having a lot of their young people being obese, right? So, but what is obesity? For you to understand obesity, you need to understand body mass index. Though there are different types of obesity, but that is not our focus for today. So our focus today is body mass index, but I will define obesity based on general obesity and central obesity. So body mass index is a measurement that uses the weight in kilogram and height in meter square. So it is defined as the weight of an individual in kilogram divided by the height in meter square. So as you are aware, if somebody has less than 18.5 is underweight, 18.5 to 24 point 0.9 is normal weight, 25 to 29.9 is overweight, 30 to 34.9 is class 1 obesity, 35 to 39.9 is class 2, and 40 and above is class 3 or morbid obesity. So that's how you categorize uh, the body mass index. So, but for the central obesity, which has to do with the measurement of the waist circumference, it measures the hip It measures the waist circumference. And how you measure the waist circumference is that the midpoint between your iliac crest, that's the bone at your this lateral part of your hip, and your lower rib, this side, the midpoint, you use a tape to measure. So for men, if the waist circumference is up to 102 and above, is central obesity. In women, if it is 88 and above, is also central obesity. So these are the major two types of obesity that exist, and they're extremely important because, especially the central obesity, it is the risk factor for hypertension, diabetes, cholesterol problem. So obesity, how does obesity develop? Though we know that there are risk factors for obesity, there are also genetics, because you notice that some people have that genetic risk of being obese. And those that have genetics, that's been observed that is because of their basal metabolic rate. What is basal metabolic rate? Basal metabolic rate is measures how fast your body functions. So the rate in which your body metabolize everything that is required for normal functioning of the body. So there are some that are fast metabolizers, or those that have, to make it easier, fast metabolizer is not a good word to use. Or you say that those that have fast basal metabolic rate or higher basal metabolic rate, and those that have slow basal metabolic rate. So those that have genetic risk of having that slow metabolic rate, basal metabolic rate, they tend to be big, because when they eat, their body does not metabolize or use it quickly. So a lot of excess is stored as fat. While those that have fast basal metabolic rate, you see that no matter what they eat, they are still slim because they have faster basal metabolic rate. So, as there is lifestyle, it's not everybody that is obese or overweight that is due to poor lifestyle. So, don't be quick to judge your patients. Try and history. If they have, they're generally on the bigger side. Very important, right? So, but apart from that genetic risk, there is also lifestyle problems. Those who eat indiscriminately, those who eat a lot of refined sugars, a lot of saturated fat, a lot of junks, right? A lot of carbohydrate. You know how people eat in the north? You see too, there is like a mountain, right? So those people are at risk of developing overweight or obesity, right? Those who do not exercise, those who are sedentary, those who are on certain medication. If somebody is on steroid for a long time, is at risk of becoming bigger. People that are on insulin for a long time and they are not exercising, they are at risk of becoming bigger. Then there are other medical conditions that will make somebody be obese, like people that have hypothyroidism, that means reduced thyroid hormone level. And there are those that have Cushing syndrome, people that have high cortisol level. So those individuals may still have obesity. All right. So these are the risk factors for obesity. So let me quickly give you, let's see the first hand that can calculate this BMI and classify it. The weight of the individual is is 83. The height is 1.72. The weight is 83, the height is 1.72. What is the BMI? Weight 83, height 1.72. What is the BMI? So write the answer. Let me see. Weight 83, height 1.72. I'm waiting. Who has a fast hand? Give us answer. Weight 83, height 1.72. I told you how to calculate it during the last lecture. Okay, 28.13. Okay. Ladi Bagaji gave us the range. Okay, so that is very good, very good, very good. Any other person? So if you write the answer, you interpret. So that you interpret for us. What is it? What is it? Interpret it. So it's overweight. Very good. So it is overweight. Very good. Very good. So the question is, what do you do when an individual is overweight? What you do is that individual does not need um, that individual does not need medication. What he needs is exercise and diet. So the exercise is at least 30 minutes a day, 5 times a week of moderate exercise. Then diet, you should avoid refined sugar. You should do portion control with a lot of vegetable. You should stop all saturated fats, right? And eat a lot of low glycemic index food, right? So for people that are overweight, hardly require medication. But people that become obese, especially from type 2, class 2 obesity, need medication. Sometimes we give medication for type 1 and class 1. So some of the medications we give are the medications that reduce the absorption of fat, such as Olistat or EcoSlim. Don't bother yourself, just for your knowledge. Then for people that have class 2 up to class 3, we may give medication and sometimes bariatric surgery. The surgery they do is to reduce the size of the stomach so that that individual, if you eat, you easily feel full. All right. So these are the things that we do. So the treatment depends on the uh, classification of the overweight or obesity. Okay. So why are we worried about obesity if it will not cause anything? So the major complication of obesity is can cause diabetes, hypertension, cholesterol problems, right? It can cause obstructive sleep apnea, where an individual will be snoring a lot in the night. Some of you that snore a lot in the night, please find out your BMI, right? So snoring, people will have problems with their joint, their knee, their back, their ankle. So they can have osteoarthritis, they can have infertility, and men, they will have erectile dysfunction, right? People with obesity can also have fatty liver, where they will complain of pain around the area of the liver, and if you do scan, you see excess fat in the liver. Okay, so any so we'll conclude here. Tomorrow we'll continue with obesity. There are other aspects of the obesity that I'll quickly point out before we go to the next lecture. So any question concerning obesity? So any patient that is coming to your PAC, you must measure, especially adults or children that look overweight or obese, you may measure the height, the waist circumference. Because if they are overweight, it can be the reason for their problem. So any question, you can please ask. Remember, we have concluded diabetes, but I can still give room for any question on diabetes. you have question on diabetes, you can also ask the any question on obesity. And one of the major challenges that we have now is individuals coming up with what do you call childhood obesity. I know most of you that are here have children. Please, if, don't give your children too much junks. And if they like all these junks, please ensure they engage in exercise, right? Exercise like playing football, riding bicycle, isn't it, and other things. So please take care of your children because there's rising cases of child obesity. Okay, Abila, for children, we will look at it tomorrow. You will not use waist circumference for children. It's only for adults. Children, there are ways to check if they have excess fat, like there are clippers where you clip their hands to see how much fat they have in their body. So we'll look at it tomorrow, other measurements. But this, what I have discussed today, is the measurement you see in adults. And this is assignment for all of you that are here. Please take your time and measure your weight. Measure your weight and height to know so that you know that if there is need for you to improve in one area or the other, you make the effort to improve. What is normal waist circumference for adult? Okay, Lois, I said that for men, your waist circumference should be less than 102. For women, the waist circumference should be less than 88. And we observe, especially women that have given birth, they are the ones at risk of having central obesity. Men that have central obesity maybe is due to the way they eat or lack of exercise or other things, right? But to be objective, measure your waist circumference. And for women, don't feel bad. It's not your fault. There is a concept. I think I still have like 2 minutes, so let me discuss it. There is a concept called postpartum weight gain. Uh, or even peripartum weight gain, the weight gain that a woman gains during pregnancy and after pregnancy. So those who have genetics of being big, even after delivery, they find it difficult to lose the weight. And since gaining that weight, they have not been able to lose it. So this postpartum or peripartum weight gain is a serious problem for women. So if you know that in your family there is that genetic risk of being big after delivery, you should make conscious effort to be doing some exercises so that you can ensure that you have reduced your weight. If not, after that delivery, you will gain that weight and you will find it very difficult to lose it. And some of you will agree with me. That weight that you have now, you gain it after the delivery of some of your children and you have not been able to lose it. So if you know that you have that genetics of being on the bigger side, when you're pregnant, and be doing some little exercise as allowed by a doctor. After pregnancy, engage in exercise and diet. You can see all these celebrities after giving birth, the kind of exercise they do. The reason is that if you do not do that, you tend to gain more weight and it will be very difficult to lose it, especially if you have the genetics. If you have slow basal metabolic rate, that means you have the genetics of being big. All right. So I hope I have answered your question, Lois. Please respond so that I can conclude. Is Lois there? Yeah. Maybe she's far. Okay. All right. So I want to thank the people that have attended. As I said, a lot of people have not attended. If you have issue that you cannot attend, please let the class rep know and he will present it to me. If it's acceptable, no problem. But you must find a way of using someone's phone and watch it later. If you have no, you don't have phone, you can use somebody's phone and watch it later, even at home or anywhere. The live session will be in my channel. I'm leaving it for you people. Or if you did not understand any aspect, you can also go there and watch it later. So I want to thank you for attending. Mohammed Abubakar, Lois Adamu, Nuruddin, Abila, okay, who else? Danladi Magaji, Siraj Abdullahi, to Faiza, Saadatu Kasim. Thank you for joining. I hope you enjoyed this session. If you enjoyed this session, you can type thank you, sir. Okay. Sharifat, okay, thank you for attending. Have a nice day. Hassana, thank you for attending. Okay, so we are going to see tomorrow. Bye bye.